Conversations on the Couch. I'm with my friend Daria, who identifies as an older nurse within our healthcare system. How do you perceive your identification as an older nurse in the hospital?
How do I feel being surrounded by all you young nurses?
Correct.
One would think, being a more experienced nurse, that I would feel more confident and competent, but sometimes I'm made to feel as if my age is more of a hindrance to getting things done because of misperceptions
or
of young people.
Stereotypes.
Yeah.
So what stereotypes do you think are associated with older nurses?
That I'm more stuck in things, that I'm too regimented and prescribe to a certain way of doing things that is more old school and not looking at things a different way, not questioning authority, doing what I'm told, being more respectful, that, maybe I'm not as quick as I should be now that I'm older, that, what I say may not be as valuable to a younger person because they feel they're being talked down to, not enlightened.
So ethically, how could you address that part of that conversation you had acknowledged about the younger generation feeling talked down to or perhaps patronized? How could you clarify that for them so they don't question authority?
Well, I think it's very important to acknowledge what they have to say and try to link it into, to use their views and what they have to say, their perspectives of things, and kind of interlink it with what we need to do to take care of a patient. So value what they have, their input on things. I may not internally appreciate a lot of what they may have to say, but I have to respect the fact that they have an input and a value to what they want to do.
And lastly, if you can think of an impact statement that you'd like to convey as an older nurse, what do you think that could entail?
I may be older. I may be more at risk for getting tired and hurting myself. But I do have a lot of experience in the old school way of patient care, of really getting to know my patients, being hands-on, being empathetic, and that there's true value in the hands-on with the patient, and that it's not all about technology.
Or, in this case too, it's not all about age.
Right.
Anything else you would like to add?
No, I'm satisfied with my answers. I just want to state that I know you identify as queer. And I wanted to ask you, do you find that your sexual orientation is relevant in the role you play as supervisor in the hospital?
I do think it's relevant because I'm in a position of leadership. So that old idiom, lead by example. So I try to convey to people that you can come to me, I'm open, I don't judge, you can tell me anything, and it's not going to go past me.
All right. And how has being queer affected how people treat you in the hospital?
So not in this current hospital, I haven't experienced any homophobia, but I left a hospital that's literally just less than 15 miles up the road because of the homophobia that I experienced. The homophobia that I experienced within that hospital was that somebody put Fruit Loops in my locker, and once I found them, originally I was very upset because this is, 2018 and we're still acting like this. So I brought the Fruit Loops out to the main nursing station and thanked everybody because I was hungry and how did you know this was my favorite cereal? But underneath I was bothered by this and took it higher up to HR, who then told me it's just a joke and that's not homophobic. You obviously haven't experienced homophobia. Within 6 months, I left for another hospital.
Okay. Has there been a recent legal dilemma in the community that you identify with that has opened your eyes to problems that are faced by other minority groups?
So it kind of harkens back to the fact that you don't realize sometimes you don't have any rights until the Supreme Court has to step in and say, you need your rights. So it's an unfortunate society that we live in sometimes, that people just can't be people. So with the summer's events shedding light onto our Black Americans and the stuff that they experience, this needs to be eradicated. And I will stand against anybody and help them through their fight.
Okay. So, let's see. What do you want me as a straight female to know about you? Who you are as a person? And what role your sexuality plays in identifying you?
I wish that my sexuality didn't have to define me. That people could just see me for who I was. Like, why do we have to come out in this society? It should just be accepted no matter what. The end, and treat everybody equally.
Okay. What is your impact? Can you give me an impact statement on you as a queer person in our society?
You know, you're asking a pretty tough question, but I've given some thought regarding this. So I'm just going to read off something that I composed. So, for a variety of reasons, going to healthcare institutions might make people nervous. Some people may feel uneasy about disclosing personal information to their healthcare providers. Others find it difficult to discuss personal health concerns. All healthcare workers should strive to create an environment in which these interactions are more comfortable for their patients. We must be prepared to serve people, regardless of race, ethnicity, religions, ages, and backgrounds, since truly healthcare is for everyone.
Nicely said.
Thanks. This concludes my 2 interviews for my assignment. I hope that I've shed some light on how it feels to be queer in healthcare and what we can do to change it. I have enclosed a larger impact statement in with my paper. Thank you for listening.